Men, you're peeing wrong. The medical truth about standing versus sitting to pee. Have you ever finished peeing, stood up, and still felt like something was left behind? That subtle pressure, that incomplete sensation. The urge to go again 5 minutes later. The dribble after you zip up. The second trip to the bathroom before bed, just in case. For millions of men, this isn't rare. It's routine. And today we're talking about something almost no man questions. How you pee. Because standing versus sitting isn't just about convenience or habit. There is real medical research behind this discussion. And for many men, especially as they move past 40, posture can make a measurable difference in bladder emptying, pelvic floor tension, urinary comfort, and even nighttime trips. Let's start with the status quo, culture, masculinity, and peeing. Most men in the UK, US, and many other Western countries grow up peeing standing up. It's taught early. It's normalized. It becomes automatic. Standing is often subtly associated with masculinity, independence, even dominance. Boys are praised for learning to aim. Fathers teach sons to stand. Public urinals reinforce it. It becomes part of male identity. But this is not universal. In Germany, a large percentage of men regularly sit to urinate at home. There's even a specific word, Sitzpinkler. While it has sometimes been used jokingly or critically, the reality is that sitting is common and culturally accepted in many households. Cleanliness and consideration are major factors. In Sweden, debates have emerged in workplaces and public buildings about encouraging men to sit, primarily for hygiene reasons. The discussion has even reached local political conversations, not because sitting is weak, but because it reduces splash, improves sanitation, and may improve bladder emptying for older men. In Japan, sitting to urinate at home has become increasingly common over the past few decades. Surveys have shown growing numbers of men choosing to sit specifically to keep bathrooms cleaner and more hygienic. Modern Japanese homes often emphasize meticulous cleanliness, and sitting aligns with that value. Now let's go further back historically. Before modern plumbing and urinals, men often used chamber pots or communal latrines that required sitting or squatting. In ancient Rome, communal latrines involved seated stone benches. In many parts of Asia and the Middle East, squatting toilets were and still are common, and squatting changes pelvic floor mechanics significantly. Historically, standing at a porcelain bowl is a relatively modern adaptation, driven largely by plumbing design and public restroom efficiency. So the idea that real men stand is not a biological truth. It's a cultural pattern that developed over time. Now let's move into Anatomy 101. What actually happens when you pee? Urination is a coordinated neuromuscular event. Your bladder fills gradually with urine from the kidneys. Stretch receptors in the bladder wall signal fullness. When it's socially appropriate to void, your brain sends signals that allow the internal urethral sphincter and pelvic floor muscles to relax. Then the bladder's detrusor muscle contracts, creating pressure that pushes urine through the urethra. For smooth, complete emptying, two things must happen at the same time. The bladder must contract effectively, and the pelvic floor must relax fully. Here's where posture matters. When you stand upright, your core muscles are lightly engaged to stabilize you. Your pelvic floor contributes to that stability. Even low-level muscle engagement can subtly reduce full relaxation. When you sit, especially with hips flexed, feet flat, and torso leaning slightly forward, the pelvic floor angle changes. The puborectalis and surrounding muscles relax more completely. This is similar to why gastroenterologists recommend leaning forward or even elevating the feet slightly during bowel movements to improve rectal emptying. Research has shown that in seated positions with slight forward lean, abdominal pressure distribution shifts, allowing the bladder to contract more efficiently without compensatory pelvic floor tension. In simple terms, when you sit properly, your body is biomechanically more relaxed. Now let's talk about the research. In 2014, researchers at Leiden University Medical Center reviewed 11 studies comparing standing and sitting urination in men. In healthy young men with no urinary symptoms, There was no major difference in flow rate or voiding time. But in men with lower urinary tract symptoms, common after age 40 and increasingly prevalent after 50, sitting produced significant benefits. Men with symptoms had lower post-void residual volume when sitting. On average, about 25 milliliters less urine remained in the bladder. That reduction is clinically meaningful for men who experience urgency, frequency, or nighttime waking. Importantly, there is no evidence that standing causes prostate cancer. That myth has circulated online, but cancer risk relates primarily to age, genetics, and overall health factors. However, posture can influence symptoms related to benign prostatic hyperplasia, or BPH. As the prostate enlarges with age, it compresses the urethra. This can reduce flow and make complete emptying harder. In these cases, sitting may help by optimizing pelvic relaxation and improving bladder contractile efficiency. Now let's expand on real pain points men experience. Frequent urination, especially at night. You wake at 2 a.m., then 4 a.m. Then you're tired the next day. Sleep fragmentation affects testosterone levels, mood, blood sugar control, and cognitive sharpness. Weak stream. You wait. You hesitate. The flow starts slow. That feeling of incomplete emptying. You stand up, adjust, and feel like there's still something there. Post-void dribbling. A few drops after you thought you were finished. Over years, these small frustrations add up. Quick pause. Before we continue, as we are talking about men's health and well-being, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Okay, now let's talk more about posture specifics. If you sit upright at exactly 90 degrees, you already reduce pelvic floor activation compared to standing. If you lean slightly forward, about 10 to 20 degrees, you increase intra-abdominal pressure gently and encourage more efficient bladder contraction. Feet flat is important. Dangling feet can create subtle tension. Some urologists even suggest that slightly elevating the heels or adjusting knee angle may further optimize relaxation, although this is more studied in bowel mechanics than urination. In contrast, standing can sometimes promote subtle abdominal bracing, especially if you're rushing or in a public setting. That bracing can limit full pelvic relaxation. Another overlooked factor is time. Many men rush urination. They squeeze at the end. They contract abdominal muscles to push the last bit out. This can paradoxically increase pelvic floor tension. Sitting naturally slows the process. It encourages patience. That alone may contribute to more complete emptying. Now let's revisit the masculinity myth. The idea that sitting is weak is cultural, not physiological. True strength is choosing what optimizes health. Many men adopt a hybrid model, standing in public for convenience, sitting at home for comfort, cleanliness, and potentially improved bladder emptying. So how do you pee the right way? If sitting, feet flat, lean slightly forward, relax your shoulders, breathe normally, and give yourself a few extra seconds at the end. Don't rush. If standing, avoid clenching your abdomen. Don't hover. Let your pelvic floor drop. Take a breath. And if you're over 40 and experiencing symptoms, experiment with sitting consistently for 2 weeks and track changes in frequency, stream quality, and nighttime waking. Finally, understand when to see a doctor. Pain, blood and urine, recurrent infections, severe weak stream, or incontinence require evaluation. Posture helps symptoms, it doesn't replace diagnosis. Always seek medical advice from your doctor on a regular basis, especially if you're over 40. So here's the bottom line. For healthy young men, posture may not make a dramatic difference. For men with symptoms, especially related to prostate enlargement or pelvic tension, sitting often improves emptying, reduces residual urine, and decreases strain. Culturally, geographically, and historically, sitting has always been part of male behavior somewhere in the world. This isn't about ego. It's about mechanics. Try sitting at home for the next week. Pay attention to the difference. Notice whether you feel more fully empty. Notice whether nighttime trips decrease. Men, your peeing wrong isn't criticism. It's an invitation to optimize something you've done thousands of times without thinking. And sometimes, the smallest adjustments produce the most noticeable improvements. Real strength isn't about how you stand. It's about how well your body works. Now, watch this video for more revealing content on men's health and well-being.